Good afternoon. I want to thank everybody for being here today. If you've been following Missouri's COVID-19 data, we continue to see very encouraging signs in the numbers. Since the very beginning, we have taken a balanced approach, and our data shows we are doing the right thing. Currently, at 7.6%, Missouri's positivity rate is under 10% of the first time since October. Right before the holidays, we were at 24.7%. Our 7-day average case rate is at its lowest since the summer, and hospitalization also continues to decline. As of yesterday, there were just over 1,400 hospitalized COVID-19 patients, down from a high of over 2,800 in November. And this is great news for Missouri. Cases are declining, the spread is slowing, and we are heading in the right direction. On top of this, we also continue to make great progress on the vaccine front. Missouri recently hit its highest daily record with nearly 50,000 doses administered in a single day. Approximately 81% of vaccines received by Missouri providers have been reported as administered, not including those through the federal pharmacy partnership with CVS and Walgreens. There are some out there who want to push the narrative that we are not efficiently and adequately administering COVID-19 vaccines, especially in the St. Louis area. This is simply not true. As you know, we recently announced a partnership with selected hospitals in each region of the state to support high-throughput vaccine distribution. The state is committing approximately 53% of our weekly vaccine allocation to these hospitals. In the St. Louis area, BJC, SSM, Mercy, St. Luke's, St. Louis County Health Department make up the Region C high-throughput providers. These providers were chosen because those 65 and older and those at high risk are more likely to have established connections with these hospitals, and the hospitals have the infrastructure in place to administer it at a timely manner. Many want the public to believe that 15,600 doses in all that the St. Louis region received last week, but that is totally false. This is what the region has received weekly through the high-throughput partnership alone, and the number will increase as supply increases. This is approximately 37% of the doses allocated to the program last week. This allocation is proportionate to the St. Louis region population. And if you start from day one when the vaccine started, St. Louis region has received their 37%, especially when you count the elderly and the nursing homes involved in this. This program does not include numerous other doses that other healthcare systems in the region received. However, it has come to our attention that the St. Louis County Health Department has not received its share of the Region C allocation that was originally agreed upon when the partnership was announced. Currently, there are approximately 50,000 first and second doses in the St. Louis area that have not been reported as administered. There should be no problem with this vaccine being shared with other agencies, which was the agreement that was made when we chose the path forward that we were going to go. Regardless, the St. Louis County Health Department will begin directly receiving 3,000 initial vaccine doses starting next week and will continue to receive steady shipments in the weeks thereafter. However, we will maintain the 37% of weekly allocations to the St. Louis region. It will not change that percentage. Quite frankly, I am tired of leaders like Dr. Garza misleading the people of St. Louis. Dr. Garza has made statements that have been absolutely false. He has led with fear and panic rather than a sense of balance, and completely ignores the diverse populations of our state and our local communities across this state. In November, Dr. Garza chose to doubt our state's balanced approach. But during that same time, Missouri began a trend that has led us to be one of the lowest transmission rates of COVID-19 in the country. Rather than admitting that there was a wrong decision about the path Missouri is on, Dr. Garza is now spreading false information about the vaccine administered in the St. Louis area to once more spread fear and panic. The people of St. Louis deserve better from their local leaders. Turning back to vaccines, the facts about the St. Louis region: 4 National Guard targeted vaccination teams are now operational in St. Louis and Kansas City, 2 teams in each city. These teams have identified critical populations, and we are working with local clergies to arrange initial vaccinations of up to 500 Missourians per team per week, not to mention the 2,000 doses allocated each week on the mass vaccine events. The St. Louis and Kansas City regions are actually receiving more vaccines from minority and at-risk populations through our targeted vaccination sites. The feuding over vaccine and cherry-picking facts must stop. Each week, when the federal government reports our weekly vaccine allotment, our team immediately fills vaccine orders for vaccinators across the state. To the extent possible, they use the state's 9 highway patrol regions to allocate vaccine proportionately to regional populations based on how many doses we receive. The overall percentage of vaccines may vary by a marginal few points in each region each week due to shipping and timing constraints. Yesterday, when the Post-Dispatch and Dr. Garza picked out specific counties in the state and compared those numbers, again, those are cherry-picking facts. If we do a max vaccination in a county, their percentages are going to go up because you did in those areas. Again, trying to just pick one metric or one data, you are always going to get false information. And frankly, we need to do a better job, all of us do, of making sure we're telling the public the truth of what's going on. The bottom line is the vaccine is not limited to any one region. We are making sure that those regions are within 2 to 3 percentage points every week, and we'll continue to do that. Every vaccinator in every region is requesting more vaccine than they are currently receiving because, quite simply, the demand of the vaccine still far outweigh the supply. And we are doing everything we can to get vaccines out as quickly as supply will allow. And if we stay disciplined and make sure we're taking care of people 65 years and older and the most vulnerable, we will move into the next stage much quicker than we anticipated as we move forward. But we have to be disciplined. We have to get the vaccine in people's arms. To help connect Missourians with more avenues to receive COVID-19 vaccine, we launched the Missouri Vaccine Navigator on Monday. This new tool will allow citizens interested in receiving a vaccine to pre-register online. Individuals will complete a survey to determine their eligibility and be notified upon activation of that phase. The Vaccine Navigator will alert individuals once they become eligible, and they can then seek vaccination from their health care provider. If their health care provider does not have vaccine available, the Vaccine Navigator will help them find mass vaccination events or other providers in the area. This will not only provide support for our citizens, but also help us determine where the greatest demands for vaccine exist throughout the state. We also continue to hold regional mass vaccination events across the state. These events have been a great help in getting more vaccines into arms, and we are thankful for our Missouri National Guard, the Department of Health and Senior Services, and local partners for their continuing efforts. The National Guard and DHS teams will return to each site after 21 days of Pfizer vaccines and 28 days after the Moderna vaccine to administer second doses. The second dose is critical to ensuring individuals and community protection. Unless notified of a location change, individuals should plan to return to the second dose at the same site they received their first dose. In addition to our efforts at the state level, the federal government announced a new federal retail pharmacy program last week. In Missouri, the federal government is partnering with Walmart and Health Mart pharmacies. I want to be clear that the state did not choose the pharmacies in which vaccines will be distributed. This week, 81 Walmart and Sam's Club pharmacies will be receiving vaccine from the federal government. Vaccine will begin tomorrow at participating locations. Additionally, 21 independent Health Mart pharmacies will soon be receiving and administering vaccines through this program. Combined, the 102 Missouri retail pharmacies are also scheduled to receive a total of more than 18,000 doses per week. Again, this is separate from the state's weekly allotment. We welcome the opportunity to work with our federal partners and provide an additional avenue for Missourians to receive COVID-19 vaccine. On a call with the White House earlier this week, the federal government also announced the launch of a new federally qualified health center program. Starting next week, FQHCs will begin receiving vaccine supply directly from the federal government to help reach underserved and vulnerable communities. On top of this, state weekly vaccine allotments are being increased by another 5%. I want to also be clear with that there will be more vaccine coming from some of the allotment from Walgreens and CVS that the state will be recovering to also add into the pipelines of the state vaccine. Like I said last week, this is a gradual and ongoing process, but we are making progress each day and are thankful for the help of our local, state, and federal partners. I cannot stress enough that supply remains the #1 issue restricting all Missourians who want a vaccine from receiving one. In Missouri, we are vaccinating our most vulnerable. The quicker we can vaccinate people in our activated phases, the sooner we can activate phase 2B. We will continue working to expand vaccine access and allocate doses as fairly and as quickly and as efficiently as possible. As I'm sure all of you are too aware, it has been extremely cold across Midwest the past few days, with more cold weather coming. While a little cold is nothing Missourians can't handle, next week is expected to reach record lows with significant wind chills. Because we want to make sure that everyone has access to heating fuels like propane, natural gas, heating oil, and right now we are considering extending the hours of service that fuel trucks can serve customers. And basically that'll be an executive order. Hopefully we'll be finished by the end of the day to waive some of those regulations to make sure if anyone runs out of fuel in the middle of the night or late in the evening that we can get those to those people on that. The other thing I would like to caution everybody on, again, I just want to make the point, if you just take certain metrics, shipping has had delays this week with Pfizer and Moderna. So we're already a couple of days behind on just receiving those shipments. So again, that is a weather-related problem, but I want to be clear and make sure that you understand that today here at this press conference and we get that information out to the public on that. With that, I want to thank everybody for being here today. I'll turn it over to Dr. Williams at this point. Dr. Williams.
Thank you, Governor. Thank you all for being here. As always, I would be incredibly remiss if I did not thank the people of Missouri. We are 4th in the country for cases per 100,000 over the last 7 days. By our data, 9th by the CDC data. They lag a little bit behind us. If you add in antigens, we'd be 12th. And we see that in every metric we look at. Our hospitalizations and our positivity rate and our R0 less than 1 for the entire state, and our mortality. And that is a testament, not to me, but to the people of Missouri, and not DHSS. It's what the people of Missouri are doing all throughout Missouri, and so we greatly thank them. We were 34th in the country yesterday for vaccinations in arms in the United States. We always want to do better. And as the governor said, we are very actively doing that. Some incredibly positive news. I was on a phone call with the White House and the CDC on Monday. I'm on the board of directors of ASTO. I represent Missouri, Nebraska, Iowa, and Kansas. And they agreed, the White House and the CDC, to take a call from us to find out things they're thinking about to get our input. And one of their caveats were we weren't allowed to talk about it. That they welcomed a free dialogue to talk about things that would affect us and to get our input before they decided, but we're not allowed to talk about them. However, once they do them, we're allowed to talk about them. And so one happened yesterday that we did talk about, that they did listen to us, and we're just incredibly appreciative that the CDC put out guidance yesterday that if you're vaccinated and you're 14 days out from your second vaccine, or for one shot, 14 days, that you do not have to quarantine if you're a close contact. And they added the caveat that that's 3 months out, but they're going to probably change that to even further. So as people look at reasons that they might want to get a vaccine, we just think that's incredibly important to take in consideration, that if you get vaccinated and you're with somebody, the science behind the Moderna and the Pfizer vaccines is incredibly encouraging, good enough that we don't ask you to quarantine. Now, they do ask that if you become symptomatic, because it's not going to be perfect, that you let people know. And you continue to wear masks and hand wash and social distance. But that's a game changer in some ways, and we're incredibly excited about that. The other incredibly positive news yesterday was I was on a phone call with General Gus Perna, a friend and colleague, and asked him specific questions about the J&J vaccine, and incredibly encouraging news there. The February 26th will be the EUA. The FDA will meet that Saturday and Sunday. ACIP will meet. And so we fully expect to have a significant amount of vaccine from the J&J, a one-dose shot, the next week. And in the month of March, we expect to see that front-loaded. I'm not going to give you the exact number because it's not exactly determined, but it is very, very significant. You may remember with the Moderna vaccine and the Pfizer vaccine that the day I wrote my order on Sunday, the next morning at 8 o'clock, we were getting 50,000 doses and 100,000 doses of vaccine. And we fully expect that same phenomenon to occur with the J&J that first week of March. And we expect that to continue the whole month of March. General Perna also shared with me that Moderna and Pfizer have recommitted between the two of them to have 200 million doses in addition to what's already been done by June. So if you add the 200 million more to the 100 million that J&J's committed, you can do the math. That's 300 million doses here in the United States by June. And so General Perna was incredibly encouraging that we will be a point in Missouri by June to reach our North Star, which is, as I said last week in the hearing and for the House, that every Missourian, no matter where you live, that if you want a vaccine, that you can receive one, and we will make sure you get one to you. So with that, again, just to follow up some questions I know you may ask, again, we've had no more new cases of the UK variant. We've done our epidemiological workup. We've tested other people around that index case and have not seen any more about that. So at this point, that remains the only case that we've had in Missouri. So if you want me to answer questions now, I will.
Hello, hi,
Hey.
I'm Emma with KMOV.
Hey, Emma.
So I know that you guys are starting to give the St. Louis County Health Department 3,000 doses starting next week.
Yeah.
To my understanding, they're also lobbed in with the hospital system.
Yes.
So will the hospital systems still be responsible for giving them vaccine as well?
Yeah. Let me give great clarity on this, okay? When we went to our model, in which, as you remember, the federal government said they had heard from out the country that people wanted a predictable distribution. That's what the federal government said, who controls the vaccine. So we came up with an allocation model because we were listening to the same people and said, okay, now that we've been committed, this is how much we're going to get. We're going to allot 53% to our high-throughput systems, 23% to the National Guard, and 8% respectively to our FQHCs, LPHAs, and other providers. But we told those entities, i.e. the Missouri Hospital Association, you've been picked and you have 3 criteria, and I said this with my own mouth. You have to do 5,000 a week. You have to commit to that. If you can't do 5,000 a week, don't volunteer because you won't be eligible. You have to be able to record 5,000 a week. You've got to keep up with your data. And the third and final thing I told them was you have to work with your partners and share vaccine with them because that's what they're good at. So whether you're Fred Rogers FQHC in Kansas City or you're a Phinia or whether you're the St. Louis County Health Department or Fred Eccles at the St. Louis City Health Department, it has always been our expectation that they will share vaccine and do what those entities do well, which is to reach hard-to-reach populations. Hospitals do some of that. Truman's good at it. But that's not what they do all day. They're more concerned with the people inside their walls. And to reach our most vulnerable populations, like when I was with Affinia 3 weeks ago in Southside, you need to use levers that help you do that. That is the St. Louis City Health Department, Affinia, St. Louis County Health Department. So in a long-winded way to answer your question, we expect them to do both. That even if they're getting our allotment, we expect them to integrate with them so that everybody wins. Because at the end of the day, for the hospitals, it serves them well if our most vulnerable patients aren't getting sick. And again, the first metric I look at every day, or maybe not the first, but the second, is according to the governor's desire, what is our rate of vaccination of people over 65, 75, and 85? And to date in Missouri, we're at 20% for 65, 33% for 85, and I think it's like 20% for 75. And that's wonderful news because those are the people who are getting sickest. So, long-winded answer, yes.
Hi, Aaron Davis with KMU8 News. My question is about the Missouri Vaccine Navigator. Is there a plan in place for people who don't have internet access or a computer to be able to use this?
Yeah, Aaron, thank you. And just to remind everybody, we launched that on Monday, as the governor said. You go to mostopscovid.com, go up in the right corner, and it'll say Register Now. You hit that button, and you see Navigator. And so the purpose is to use that as kind of our go-to place. We are aware of your concern, so we have a hotline that you can call, and it's manned right now 7 to 7, Monday through Friday, 7 to 5, I think on Saturday, and closed on Sunday, but we're looking to ramp that up. We were having a 7-second wait time, but that's kind of gotten a lot. We're not reaching that this week, so we're bringing capacities to that. So what I would encourage people to do, if you're not facile with computers or that kind of thing, is call the hotline and they'll walk you through that.
And where can we find that number?
1-877-435-8411, if I remember correctly. Yeah.
Hi, just 2 other quick questions. Yeah. So I know that Governor Parson touched on this a little bit, but early on, we've been getting a lot of calls and emails from viewers in the St. Louis area saying, why is all of this vaccine going to the rural areas? And yesterday on your call, you said it's going to ebb and flow, it's going to change. Sometimes it's going to be more concentrated in rural areas, and then hopefully that'll change. But can you just answer why a lot of those National Guard sites were put in rural areas, and we're getting a lot of emails saying it's hard to get in St. Louis? Yeah,
and so I just want to give you great clarity on this. If you remember when we started this on December 14th, much of our vaccine went to urban areas. It went to St. Louis. It went to Kansas City. It went to Springfield because we needed to protect our health care chain to take care of sick patients. As you remember back in November and October, that was a good decision. And so it was front-loaded in our urban areas. And then when we went to our allocation model with 53% going to our hospitals, They also, the SSMs, the St. Luke's, the Barnes Jewishes, the Trumans, are located in urban areas. To offset that, we allotted 23% to our National Guard, which have predominantly been in rural areas, but they've also been in our targeted campaigns. I saw on the news last night, one was in St. Louis last night, in North St. Louis, doing vaccines. So I think it's a perception problem, because to the governor's point, I look at it, as of January 26, it was identical. The population in St. Louis was identical to the amount of vaccine they got. It was 37%. Now, there's going to be ebb and flows. We get that. And you've got to remember, there's more vaccine that goes than just goes to the high-throughput centers. There are people in long-term care facilities, which happen to be often in our urban areas. There are people in the National Guard still going to the Region C, which is the St. Louis area. So when you look at that entire picture, I think it is a perception problem that people are taking advantage of. They see the National Guard go into a community and give 2,000 vaccines. Well, sure, you're going to bump up the percentage. It's never going to be perfect. It's never going to equally match the percentage of a county. And we take other considerations into mind. We look at geographic, we look at population, but we also look at where our elderly senior citizens are. And they proportionally are more in rural areas if you look at the percentages. So I don't want to make it sound like it's just a cookbook thing where we look at the population and we look at the vaccine and try to match it up, because it's a clinical judgment of many things. But to the governor's point, the allocation, just particularly for the St. Louis region, has and will continue to be probably pretty proportional to their population.
And is that why you guys are sort of upping our allocation next week? I was looking at that chart, and it looks like we're getting more doses.
A slight increase, but again, this idea that it's being doubled is just fallacious. It's just not true. We are slightly increasing it to adjust for variations, and we will do that. And you've got to remember, in March, I think we will double the amount of vaccine we have. And we will change our distribution system then. One of the things Governor has preached, being a former sheriff, is you got to react to the situation. And when we get twice as much vaccine as we have now, we may change our distribution system. We may change our allocations.
One other quick question.
Hi, Dr. Williams. I have a
Hey,
question.
Jessica.
How are you doing?
Good. Hope you are.
Good, thank you. So I have a question for you about the variant. I know there's only one confirmed
Yeah.
case, and I understand the state's doing surveillance
Yes.
testing, and Lisa mentioned that every 2 weeks you're sending 25 samples to the state labs. So why such a small number, and how can we make sure there aren't more cases throughout the state?
Great question. We look at 500 samples every day, and then we send, when we look at that 500, we're identifying about 25 that we think might have the S gene drop, and we're sending it off. But I just signed off on something this morning in talking with the ID doctors that the governor and I talk to every Saturday morning. They clinic, now this will get a little complicated, but right now all we're doing is acting off what we see in a lab. That doesn't look right. We better check it. But we have clinicians tell us, we get a little worried when somebody's had the vaccine and they come in with COVID 3 weeks later. Could that be a variant? So I asked them to work with our people, and so I signed off on this morning that clinicians around the state will be able to call us and say, there's just something about this that makes me nervous. It's not your garden variety COVID-19. I'd like to get it checked, and that should be going out later today. So to your point, you'd say, Dr. Williams, you're doing, 15,000 tests a day. You're only looking at 500. We're adding that layer to it to bring doctors in to use their clinical judgment to maybe alert us if there are more cases.
And then I know...
Hey,
Dr.
Emily.
Williams, two quick that I'm combining really quick. First off, when it comes to health departments, we've talked about hospitals.
Yep.
How do health departments get what they're supposed to get? Are you looking at that the same way you are hospitals? And the other part of my question has to do with last week, you and Governor Parson both got up there and talked about how there's been some places that you had to call and say, stop cutting people in line.
Yep.
I want to know if you found any more of those, because yesterday you mentioned it on the call, and if so, what are you kind of saying that, are they in trouble? Are they not getting the vaccine?
Yeah, so far, called one yesterday afternoon, and they assured me that the only teachers they had vaccinated were they had a few extra doses. They were going to waste them, so they vaccinated those teachers. So that was one yesterday. I called another clinic that was brought to my attention. Anything that's brought to my attention, I call. And the medical director said I could come look at every chart in that clinic and that she had documented that every patient in there met our criteria. Now, I think the venue made some people suspicious, but she said, Dr. Williams, you are welcome to look. Everyone's over 65. Everyone has an eligible condition. I called another one, and somebody had posted on Facebook that they had gotten a vaccine, and it looked suspicious. And I called them, and they assured me that that category of people were all eligible. They just happened to be teachers, but those teachers also had conditions that warranted. So I call every one of them because the governor's asked me to. And to date, I have not had one that met the criteria I talked about last week when I called and they said, oh, yeah, we did it. They didn't meet criteria. We just decided to do it. I've had no more of those. But if anybody out there has a concern, they are more than welcome to get in touch with me. I will call them personally. Thank you, Kelly.
Thank you. Just to clear up a couple of things, kind of listen in the background. I want to be perfectly clear about this. Probably since I've been governor, I have probably spent more time in St. Louis and Kansas City and resources, whether it was civil unrest, whether it was helping the communities, helping the African American community, and continue to do that to this day. Not only make promises, but make commitments and follow through with those commitments. The idea, because I come from rural Missouri and there's some magical divide that I'm taking care of rural Missouri any more than I am urban area, is totally false. And just the opposite, it's probably worse, because I try to make sure and overcome that those things don't occur. But I will assure every one of you, and I would ask you to report that. Each region of this state will be treated equally. We are all Missourians in this battle against COVID-19. Everybody deserves a chance at a vaccine as soon as we can get a vaccine in their arm, and we're going to make sure that's done. And when we send 3,000 doses to St. Louis County or Jefferson County or Franklin County, that is going to come out of the percentage of doses in the St. Louis region. It's not going to change that number at all. It's just going to be a different allocation. When we go to Tier B2, then we'll have a different distribution plan in place because we know there's going to be much younger. So there's a lot of moving parts to this every day, but the one thing I want to assure the public is that nobody will get treated any better than anyone else. We will make sure that distribution is evenly, and we have done that at this point, and it is a very complicated thing to do, but we continue to do it.
Switching subjects, on the unemployment overpayments. Yesterday, the members of the House committee talked about some different options, and one of them would be to basically forgive the federal portion, and I might have this a little bit mixed up, but use CARES Act money to cover the state's portion of this. Is that something you'd be willing to consider?
You know, I think we're early in the game on this to try and discuss that. I'm not sure what that ending project will be, Kirk, but I mean, we're open to things. I'm not saying I close the door on anything if we can figure out how to make it right. But one thing you got to do is you got to remember we got to make that fair across the system, and that's taxpayer money we're talking about. That's everyday people's money. So, you know, you got to figure out what that path is going to be. But I'm not sure what all the discussion was in that committee hearing where it's going.
Governor, there's been a lot of discussion, a lot of push from the St. Louis, Kansas City region for curators on the University of Missouri who have strong ties to the campuses like UMSL and UMKC and Missouri S&T. And I'm wondering how that is influencing your thinking on the appointments that you have pending and when you might think you might make those appointments.
Yeah. Rudy, I will try to be as professional as I can with you. I have told you that I have no respect whatsoever for the organization you represent. I do not think you are a Missouri media outlet. I don't think it's fair to these reporters that are in here today that you're a Virginia-based media outlet and you're simply here to do what you asked today. The only thing you ask is because of the Kansas City Star, which is totally biased towards any Republican, any conservative, and you're trying to make a story out of a pick of a curator that's been going on for years and years where governor picks the people they want. And I'm going to continue to do that. But I am not going to recognize you as a legitimate reporter or a legitimate firm here in the Capitol. Anybody else got any questions?
Okay, thank you.
All right, thanks, everyone.